Hello, I'm Nan Roman, President and CEO of the National Alliance to End Homelessness.
Hi, I'm Emily Mosites. I'm an epidemiologist at the Centers for Disease Control and Prevention, and I'm the Homelessness Unit Lead on the COVID-19 response.
Obviously, people who work on the front lines of our nation's homeless response system need all the information they can get about COVID-19. So this conversation is to make sure that everyone is up to speed on the CDC's guidance on this issue. And we're very grateful to Emily for helping us out today on that score. Our first question is, how should communities protect the health of people who are unsheltered, including those who may be in encampments?
So there's a couple things we already know about unsheltered homelessness. First, it's that it's complicated. There are a lot of partners involved in protecting people who are experiencing unsheltered homelessness. And so it's very important to start off with clear communication and a clear plan for protecting people. The next thing we know about unsheltered homelessness is that it's associated with poor mental and physical health outcomes at baseline. So priority number one should continue to be to link people to housing. When it comes to COVID-19 spread, we want to translate CDC's scientific guidance for the general population for people experiencing homelessness. There are three key components to that guidance. One is staying home, another is keeping distance from others, and then finally, washing your hands. So of course, we know people experiencing homelessness cannot stay home, but we want to link them to housing where possible. And then if we can't link them to housing or individual rooms, we want to allow them to remain where they are to prevent them from dispersing without a clear plan for where they can go. When we're talking about keeping distance from others, we want to communicate very clearly with people experiencing unsheltered homelessness to make sure they understand the risks associated with COVID-19 so they know why they need to keep distance from other people. If they're staying in an encampment, we want to make sure there's enough space for each person, at least 12 feet by 12 feet of space for each sleeping area. If an encampment is too crowded, then it's important to link people to individual rooms or safe shelter to help decompress that encampment. Next, washing hands. So work with community partners to make sure that encampments have sanitation that is going okay and have access to restrooms that stay open or portable hand washing facilities.
Some localities are providing individual rooms for people experiencing homelessness during the pandemic, including in hotels and motels. How should jurisdictions and programs prioritize people for these private, non-congregate accommodations?
Some jurisdictions have been able to provide individual housing for people experiencing homelessness while COVID-19 is spreading. This individual housing, these individual rooms, can be an important way to prevent spread because there's less likely to be spread from individual rooms than in shared settings. There's two ways to think about these individual rooms. One is to protect people within them from spread, and the other is to protect people outside of them from spread. So when we're protecting people within the rooms from spread, this is called protective housing, and we want to prioritize people who are older than 65, or who have underlying medical conditions like heart disease, diabetes, or other conditions. When we think about protecting people outside of the room from spread, this is where we're thinking about quarantine and isolation housing for people who may be infected or who are confirmed to be infected with COVID-19. So it's important to make sure that these two types of housing are not located in the same place because we want to prevent spread between them.
In a homeless shelter, what would you recommend is the best layout for achieving social distance and protecting residents?
So first is related to beds. Beds should have head to toe alignment and people's heads should be at least 6 feet apart. Similarly, in dining areas, seats should be at least 6 feet apart to maintain social distancing. And then we also want to think about, in terms of layout, where people with symptoms will go. People with symptoms should either be in individual rooms, or if individual rooms aren't available, a large, well-ventilated space with temporary barriers between beds. People who are confirmed to be positive with COVID-19 should stay in individual rooms, ideally. There are going to be some shelters that are not able to accommodate people who have symptoms or are positive for COVID-19, and in which cases there should be an alternate site located for these individuals.
Our next question, how should shelters address other challenges that come up in group facilities like shelters? Things like congregate meal service or shared hygiene facilities. How much space needs to be provided for people when they're not in their beds, for example, when they're socializing?
There are several considerations when it comes to a congregate living situation, not just layout. So there's a couple processes that, that shelters can put into place to protect people even further. One of those is staggering meal services. So you have fewer people in the dining area at any one time. For example, you could have a dinner service at 5, 6, and 7 p.m. with specific groups eating at each of those times. You can also consider putting in maximum occupancy limits for bathrooms or for common areas. And then finally, it's also important to recognize that sometimes it's not possible to keep 6 feet of distance, and we want to have extra protection as well. So in these cases, we, just like the general population, want people to be wearing cloth face coverings. Staff should be wearing them anytime they're working with others. Clients should be wearing them anytime they're not in their individual space or in their individual room. Important to keep in mind, though, there are some people who should not be wearing cloth face coverings: children under 2, those who are having trouble breathing, or those who can't take off the mask by themselves.
How does the CDC define exposure to the virus? And what is the indicated course of action if someone or even a number of people in the facility have been exposed?
Exposure is defined as close contact to someone who is infected with COVID-19. And close contact actually has a pretty specific definition at CDC. It's defined as being within 6 feet of someone who's infected for at least 15 minutes, starting 2 days before they experience symptoms, or if they didn't experience symptoms, 2 days before they had a positive test. If you've been exposed to the virus, it's recommended that you quarantine for 14 days and monitor yourself for symptoms. It's also often recommended to get a COVID-19 test during that time. At a homeless shelter, exposure can be difficult to ascertain because there are a lot of people often staying at homeless shelters. And so it might be the case that everyone in a shelter might be considered to be exposed if there's been someone who's positive staying or working there. In these situations, that local or state health department can follow up to identify the next steps.
If someone is COVID positive, what is necessary to prevent the spread of the virus? What steps should the homelessness system take?
The first thing they need is somewhere safe to stay. So they can either stay within the shelter if there's isolation capacity available, or at an alternate location. That person is going to need access to medical care in case they have symptoms and those symptoms worsen. They're also going to want to wash their hands regularly with soap and water for at least 20 seconds, or use alcohol, 60% alcohol-based hand sanitizer. You can use CDC guidance to clean where the person has been staying, and there might be additional preventive actions for the homeless shelter to take, and those should be taken in coordination with the state or local health department.
And our final question today, when can a COVID positive patient return to a group setting?
They need to be isolated for a certain amount of time to prevent spreading to others. They can end their isolation if it's been at least 3 days since the resolution of their fever and other symptoms without the use of medications, and at least 10 days since their initial positive test. If they didn't have any symptoms, then it needs to just have been within at least 10 days since their positive test. There's also a test-based method that can be used where if someone has 2 negative tests at least 1 day apart, they can end their isolation. This test-based method can become a little bit complicated though, because sometimes a person can test positive for several days or weeks after their symptoms resolve. Even though we're still learning about the virus, it's not believed that a person in this type of situation is a risk for spreading to others.
Emily, this has been so helpful. Thank you for taking the time to do this video and for all that you and your colleagues are doing during this emergency. I know I speak for everyone when I say we're tremendously grateful for your leadership and your guidance. Thank you. And thank you for doing the video.
Well, thank you so much for inviting me. And I just want to say that I'm so grateful to the homeless service providers that are out there every day protecting people experiencing homelessness from COVID-19. You can find more information and full guidance on the CDC website under communities, workplaces, and schools. There's a landing page specific for homelessness resources.